Welcome to Glow Up and Get Real. Have you ever wondered what goes on behind the serene walls of medical spas? From wild client requests to jaw-dropping disasters and the daily pain in the ass stories that never make it to Instagram, we're spilling the tea. Whether you're a seasoned pro or just spa curious, get ready for the hilarious, shocking, and brutally honest side of the medical spa. Welcome to Glow Up and Get Real. I'm Amy Ingle, the Sweet Face Injector business owner and trainer. Every week, we're injecting the latest on med spa trends, client concerns, and the boldest new treatments out there. Want the latest in safety, advanced techniques, and business strategies? You're in the right place. So, let's glow up, get real, and level up your beauty game. Welcome to Glow Up and Get Real. I'm Amy Ingle with the podcast, and I have here Amber Schaffer. Yay. And this is a special episode because we are in our small sweet spots and we're just like having a great day, having some champagne. Cheers. And we're going to talk about something very interesting. So our first question is, Amber, tell me a little bit about yourself.
All right. So I began my medical experience starting in 2005, I guess, from radiology tech. Then I worked at an urgent care and I saw how cool nurses were. And I was like, I want to be like them. So I went back to school, went to Nova Southeastern University and got my bachelor's degree. Then went back to school because the whole COVID and the furlough incident. So I said I needed to get, I'm an essential worker, so I need to get my master's and I want to get my nurse practitioner. But then I figured, you know what, go gung ho and get my doctorate too. So back to Nova Southeastern University, got my master's and doctorate, and here I am.
Here you are. And so you're in the medical realm of the spa industry. Mm-hmm. So tell us a bit about how you got involved in that.
Well, okay. So it all started when I was having some hair loss.
Hair loss?
As you know.
Okay.
And I saw it you. And just how amazing you are and your personality. And I was like, I want to be like her.
Oh, that's sweet.
Yeah, that's the truth.
That's so sweet.
So yeah, I was like, and I kept hounding you, didn't I? For after my Botox injection, if you need a nurse practitioner.
But you weren't one yet.
No, I wasn't. But I was in school. You knew about it. I think I hounded you for a few things. Yeah. Then it was either aesthetics or behavioral health, as you know.
Same in the one and the same.
It actually is. It's amazing. I'll have like a whole therapy session with my clients, which I do love. And when they trauma dump, it doesn't bother me at all.
Trauma dump. I like that. I never heard that before. Trauma dump. Nice.
So, yeah, I'll sit there and listen because I can relate and sympathize. And, a lot of people need like an outlet. So while you're sitting there injecting and such, and they explain their experiences. I'm like, oh, yeah, I've been through that before. So then, yeah.
That's how you're related.
Yeah.
And so then you came into the medical spa at Sweet Spot and you've been there for 2 years now. And what would you say? Good move? You're still looking to do something else? What, do you love it? You hate it?
I love my job. Everybody knows I love my job.
Yeah.
Yeah.
Good. What do you love about it the most?
Because I'm sculpting. It's art. I love making people happy when they leave and they have that confidence. It's like, I did my job. Yeah. Because I worked at the hospital for, I don't know, 2 years. And then I worked at an outpatient. And, you're always in that field where the doctors give you that depressing news. You have cancer. So like this job is amazing. You have happy results. You don't have like clients coming back. Yeah.
Well, happy results. But the reason we're here today is talking more about those unhappy results that we sometimes get, or some of those clients that are just not happy with us, right? Yeah. So let's dive into the questions that I have for you. So let's chat. So are there any red flags that you look for that signal a client might be high maintenance or potentially problematic?
So there are a few, but it's not everyone, because I have some great clients that do this and they are not problematic.
Yeah. Let's just get that straight. We love almost 100% of our clients, but there's a few that are a little high maintenance.
Yeah. Ones that come in, they're like, I can't bruise, absolutely no bruise. I need it here. And, it's just like, gosh,
Or they come in and say, nobody's bruised me before.
oh, yeah.
Really? You're getting an injection in your face. You're
It's a
getting,
needle
yeah,
and you're causing trauma to the skin. You're going to bleed.
yes.
And especially the ones that are on the blood thinners or the tumor. Is that your
Take an
point?
ibuprofen like 3 days before. They're going to bruise.
Yeah.
Absolutely. Okay. Any other red flags? Oh, I don't allow that. I'm like, give me that mirror.
Oh,
Yeah,
I
no.
have a few. Do you have a mirror? It's
Yeah.
just like,
Now, a mirror for consultation's perfect. I always use a mirror pretty much when I do a consultation, like have a look at here. But when I'm doing the procedure, I do not want them watching me do that because
oh, yeah.
they
I
can,
learned my lesson on one client.
yeah, they can tell you how you need to inject and where to put the needle, and
Oh,
that's
that's what happened.
yeah, yeah. And then what happened? Then when that did happen, what was the result?
We're done.
Mhm.
She was telling me how to inject,
Mhm.
and she was questioning why I was doing it on Ingle, and that's the way I learned and was taught. So when you're questioning my technique and you're
Mhm.
not the nurse injector,
Yeah.
you'll bleed. So I stopped.
Yeah.
And she didn't get a certain area done, and that's on her.
Right. Yeah. She's just if she's going to come to you and trust you with her face, then she needs to let you do it 100%. After you've had the consultation and she's agreed to the procedure, she needs to just let you do your job, right? And if not, I've had to say, "Listen, this isn't going to be a good fit. Go down the street. Go down the street because
Backyard Botox.
backyard Botox." And they actually will never be happy, those kind of clients. So, it's good to just like, "Thank you very much for coming in, but we can't help you today." They leave the country?
Yeah, they always leave the country. They leave the country and they are like,
Or the
the
state.
toxin didn't work.
Or this, yeah, we have a couple of those that, yeah, leave
They're
the
always
country.
leaving, aren't they?
Yeah, really bizarre. Okay. Okay. So, can you share a story where a client's expectations were wildly unrealistic? How did you manage the situation? We learn every day.
That is the truth. Yes. I would say an unrealistic expectation is when a client comes in and they want their cheeks, jawline, and chin, and they want one syringe of filler.
Just one? Can't you do that with one, Amber? Come on. You're a super injector. No? So, if you were going to get your cheeks, jawline, and chin, how many syringes do you normally recommend? Depending, kind of average.
It all depends.
On the
Everybody's different. So, like for cheeks, I would say either half or 1 and 1
syringes. Okay.
Yeah. For jawline, that ranges from 3 to 5. I have done clients where it's like a few that needed.
If you're doing jowl, you definitely need one for jowl. So that'd be 1 and 1 for both sides. And then jawline, usually you need 2 on each side. If it's a man, you might need 3 to make that chiseled jaw look. Yeah. So, and then the chin, yeah, the snatch. It's the hot word, snatch. But then the chin, probably another half to 1 cc as well. So it just depends on the structure. Yeah, I like that. I just want one syringe for all of this. I'm like,
oh yeah,
no.
Oh, even
That's
a
not gonna
client
work.
who requested disc port, and they were like 30 units for the whole face. What?
And
30 units?
30 units for the whole face.
Yeah, I had a client say that to me.
Yeah. Don't think so. Try
That.
again. Okay. So, what's the most bizarre or unexpected request you've received from a client?
Say the most bizarre. I mean, maybe it's not bizarre, but it was to me. Was Kybella to the
The
liver.
cheek? Yeah. So, Cabela, it actually dissolves fat through dicolic acid. We don't even do that anymore.
Research people can say it.
No, we don't even use Kybella anymore because we just feel like there's not enough of a result and you need multiple treatments. It's just clients aren't satisfied with it. Maybe some people have had a great reaction, but we have other things that are better now. Kybella's been out for years and now we have like Ativa, which I think is a better solution. It's more natural So, yes. And if you would have done it there, what would have happened? Well, you could hit a nerve. That's the problem. That's why we don't inject there. You could do some damage to some of the facial nerves and then they might not smile so pretty anymore. So we stay away from that area. But
definitely that, and there's another one actually when people want filler here. And I'm like, no.
I'll do it.
I've done it. I'll do it to one client and one client only.
Oh yeah.
But otherwise I am not about to lose my license over blindness.
Yes. Well, I will only do it if I've seen them multiple times and I
Right.
know they'll come back to see me.
Mhm.
B, they're getting a neurotoxin every 3 to 4 months, because if you don't paralyze those muscles, there's no point in putting filler in there.
Exactly.
No point.
Yeah.
And you have to put more filler in if they're not using the toxin. So they have to do that. And then three, if they understand all the risks involved with that, I will inject here into the static line of the glabellar after all of those things are very superficially, almost intradermally, actually. So, and I've had success. My clients love it, but
Yeah.
there's only a few that I would
Exactly.
trust that I would do that with. So,
Yeah.
you've got to be a very VIPer with me to be able to do that.
Yeah.
So, yeah, absolutely. Oh,
Uh-oh.
how do you deal with clients who are never satisfied no matter what you do? No matter what you do. I know. I get the phone call. I'm like, Amber, you can handle this on your own. But first of all, how do you approach that?
I mean, I hear what they have to say and I listen and I try to make people happy. I am a people pleaser
Mm-hmm.
within reason. I mean, there's certain like if they have these crazy expectations, I want a full free syringe, blah, blah, blah. It's like, oh, come on now.
Yeah.
I don't see the results in my lips and it faded within 4 months. And filler blindness. I know I'm talking about everything, but
No, that's good.
yeah, the people who have like filler blindness and they think that, the syringe dissolved within.
So filler blindness, describe what that is.
So it's when a client will come back in and they'll say, I don't see the filler anymore. It's not there. But then you show a previous picture what they look like. And you're like, no, it's still there. But you get so used to seeing your face and lips a certain way that you think the filler.
Yeah, I agree. It's all kind of in retrospect too. Someone comes in and you do some work on their face with some filler, they get used to it, and then they think that we cause some issue when it wears off.
Oh, yes.
For instance, like Botox, they get Botox for a couple of years and then they stop, maybe because they've moved, they haven't found a new provider, or they just feel like they can't afford it, they're saving their money. And then they feel like because we did the Botox all those years, we made their face look older. This happens all the time. And we age every day. I always say a baby's skin, a newborn skin, replaces itself every 3 days. An adult skin replaces itself every 30 days. So we're aging every day. We can't stop the clock, but we can actually kind of slow it down. So I do get those clients that think that we've made their face worse because we've injected them, which is not the case. They just didn't realize they've aged over the years while they were getting treatments.
Or they lose weight.
This is true. Ozempic,
And they have skin.
Wegovy.
Yeah, exactly.
Mm-hmm.
It's like,
Mm-hmm.
no, that's you losing weight.
Mm-hmm. And that's like talking about that. I mean, it's all over the news, all over social media. Oh, if you take semaglutide, Ozempic, Wegovy, whatever, that you're going to have all this loss, all this fat loss, all this bone loss, muscle loss. And it is true, but you have to exercise, you have to eat properly, you have to take nutrition seriously when you do these weight losses to prevent some of those losses, because they would happen if you lost weight naturally, without drugs. So we have to do a lot of educating, don't we?
Yes, we do.
Okay, so got one for you. I like this one.
Oh boy.
This is good for you. How do you set boundaries with clients who want to overstep, whether it's after hours text or demanding special treatments?
Of course you picked
Amber,
you picked this one. All right.
you only give me one syringe and it doesn't look right. Oh, but in my notes I see that I suggested two. So tell me how you deal.
Oh, yeah, I will suggest to people, especially the group one that say 30 units and that's all I need. So I will write the suggestion is, recommended the units, blah, 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 but they're on a budget or they have unrealistic expectations. And so I will write everything in my notes. That way we don't, they point fingers at us.
Yeah.
Such. Yeah. That. And then I used to, and Amy killed me for this one, give out my personal phone number.
Don't ever do that. Don't ever give your personal phone number out. Ever, ever, ever. Yeah, you did. Yeah, you did. There's a reason the spa has a business number. Yeah. And we also have social media. They can go on social media and ask questions or give us messages to call them back. We also have text messaging. So there's lots of options.
We look at it. We look at it 24/7. So if there's something that's a dire need at midnight, I'm sure one of us will press it.
Mm-hmm.
We'll see it and address it.
So, okay, what's your go-to strategy for de-escalating an angry or upset client? I know what you're going to say. I do. You call me. Yes, you call me. So I'll answer this one. So I used to get all worked up and be like, I'm going to say this because this is what happened and blah, blah, blah. That will get you nowhere. That will get you nowhere. That'll only make things worse. And I learned over time, you just have to step back, take a deep breath, and own it. And by owning it, just have sympathy, just be, there for the client, listen to their concerns, even if you don't agree with it, just listen and then try and make things better. I mean, we had that one client that got a package, this was recently, got a package for body sculpting and decided it wasn't working for her. So she demanded or asked, I'm not sure, she talked to you, if she could then cut her package up and use that towards another treatment.
Right.
Now, we don't do that, but this client was really upset. She didn't have the expectations that she had expected, although we never give unrealistic expectations, but sometimes the clients don't hear that. They don't hear it. They hear what they want to hear. However, I did say, hey, come back in. We'll do a different treatment just to help smooth things over. It just depends on the client too. Sometimes if they're nasty to me and they're just downright mean, I will not step forward and give them something to reimburse them with. I'll be like, no, if you're going to act that way, I'm done with you.
Right.
But if you're like, sincerely, want to speak to me in a professional manner, then I'm more likely to kind of give back. So there you go. Absolutely. Absolutely. Okay. So the next one, have you ever had to fire a client? Have you ever had to fire a client? And what led up to that decision and how did you handle it? Oh no. Here we go again. I shouldn't even ask that.
Oh, you know it too.
Yep. Time for a drink.
Yes.
Cheers. So what would you say about that one?
Oh, she ruined my Christmas.
No, she ruined your Christmas?
Yeah, back in no, I'm kidding. So when I first started with Amy, I had a client who was very upset that she bruised, needle to the face, people. She bruised and
you didn't punch her. Needle to the face.
But coincidentally left the country.
Oh.
Just, stupid me gave my personal phone number, so she would text me that she was unhappy that she bruised and just every day. And I don't know what to do. She left the country. I told her to get arnica, get some heat to have your blood or have your body absorb the blood.
Like IPL treatments.
Yeah.
She left the country.
I don't know what you want me to do. Yes, I heard you every day. You're bruised. You're not happy. You're bruised. You're not happy. I got it.
Mm-hmm.
So, I was like, I'm not letting her ruin any of my Christmases or holidays ever again.
Mm-hmm.
And so I just said, please do not assign this client to me anymore.
Mm-hmm. Mm-hmm. Something that I do, it's like reverse psychology pretty much, is when somebody bruises, usually right away, but they could wake up with a bruise the next day, So what I always do is I say, you're bruised. Okay, well, let's review kind of what medicine you took beforehand. And probably 9 out of 10 times, I'd say almost 10 out of 10, they've taken ibuprofen, Motrin, aspirin, turmeric, fish oil, like within 5 days. So I kind of turn it, and alcohol, yeah, I don't count that one, but Anyway, but I turn it around and say, listen, these are in your pre-procedures. They're online. Before you have your procedure, this is what you need to avoid. We have it in our consent forms. So because that happened, that's why you're more likely to bruise. That's why you have the bruise. So I always kind of turn it around to give it the responsibility of the client, because not everything needs to be our responsibility. We can tell them till we're blue in the face, and we have done it, and it doesn't matter. So we have to sometimes give them the responsibility to listen to us and to read the consent form before they sign and to go online and see our pre-treatment instructions. I mean, I do that often, and that sometimes helps de-escalate because they're like, oh, you're right. So that's just kind of a word of advice from over the years that I've been doing this. I mean, and we are the ones that put the needle next to the vessel that caused the bruise, right? We are the ones, but not everyone's anatomy is the same.
Vessels are not all in the same place.
No.
You inject.
And we don't have x-ray vision,
Nope,
so we
sure
can't
don't.
see them. So we try so hard to follow our procedures and our protocols to minimize bruising, but there's just some things out of our control. And that's in our consent form, and that's the most important thing. Just have that in your consent form so that all the responsibility doesn't fall on you, the injector.
Exactly.
Okay, so how do you keep your team motivated and positive when dealing with difficult clients or tough days? Yeah, so when you're like in the spa and Zoe's at the front desk and you got somebody coming in that's like, whoa, we know we might have a little issue on our hands, or the issue happens after the procedure. How do you keep the morale up in the spa?
Well, just okay. Well, with them, they kind of just, I'll be an outlet. You guys dump on me. I'll listen to it. But I mean, you got to stay positive. You got to keep the spa going, keep people positive, because you don't want it to ruin your whole day.
I always think laughter helps.
It does. Laughter.
Yeah.
Best medicine.
Comedy. We're not making fun of clients,
No.
but we are trying to make light of some of the situations to help ease some of the stress in the spa. So that always kind of helps, I think. New med spa professionals about handling pain in the ass clients. What would it be? What's the advice to new med spa professionals?
Just try to keep the clients happy.
Yeah?
Yeah, that's what I think, because that's the way you gain business. It's the way you keep them coming back. Keep them happy.
But you can overdo it too, don't you think? You can overdo it, over kiss their tushy, and then it can backfire on you. That's happened to me before.
A lot of supply, you lose out on the money. You pay for all that product, and then you're just giving it for free to a few,
or your time
and the time, and they're just not happy. You're just not making them happy.
And it's all based on the foundation of unrealistic expectations. We're not a plastic surgeon's office. We can't do full facelifts, nor do we want to, but we can slow time down by gradually introducing, neurotoxin and filler and Sculptura and radius. There's all kinds of things we can do to slow down the aging process and just kind of make people feel more confident in the aging process as well. Yeah. Okay, one more. This is what I ask all my guests is, what is your sweetest tip of the day?
Don't freak out and stress out the injector. That is my sweetest tip. We know what we're doing. Don't stress us out. Trust me, I have the sculpting idea in my head. I don't need anyone to be like, don't bruise me, because that's not my intention to bruise, but things happen.
Yeah, absolutely.
Don't stress the injector.
And don't stress the injector. Do you have any questions for me?
How do you deal with running a business and everything else you do?
Well, I've been doing it for 8 years. So it started out slow. I didn't open up a Medi Spa with 14 employees and, 5 injectors and 2 locations. It didn't happen. It started small in little bits, and just over time, it's just easier to grow to where we're at now than just opening up something, boom, with all the equipment, all the supplies, all the injectors. It's like baby steps. That's the best way to open your business. So if you are wanting to open your own medical spa, I would suggest getting a small little space. I was in a salon suite. It was like the size of a bathroom. It was so tiny. I couldn't even move in there hardly, and there was no way I was going to have a piece of equipment in there like a laser. There was no room. And it was good because lasers are very expensive. So I waited about 2 years before purchasing my first piece of equipment. And the laser I got was a multifunctional. So it could do a lot of different things, which was great because that way I could offer a lot of different treatments to help pay off that machine. So it's just doing it in small increments, I would say. Don't go overboard. Don't do a lot of marketing. Do free marketing. I have to say, Groupon was my go-to when I first opened because it's free. I did lose about $10 per client, but I looked at it as a marketing fee. Some of my clients that I have today that come in every 3 to 4 months regularly, we were talking about one of them earlier today. She was a Groupon. And I have some of the best clients that came from Groupon. There's some that just Groupon shop and you'll never see them again unless you put another Groupon up. But for the most part, I have some amazing clients, and you do too.
I do.
Yeah.
I do. I really do. And I have Punta Gorda clients that will drive to Fort Myers for
which is
treatment.
about a 40-minute drive. Yeah. And not only that, is Groupon's not like a do all for all, every all. I did it for the time being to grow the practice, and it really did help. There were nice reviews on Groupon that helped with just growing. But then once I got to that point where I was like, okay, I have enough clients. I think I can stop the Groupon now. Let's just see how word of mouth does, and just, talking to other people and just bringing in other clients through our Google reviews. That was another thing. That was like the second thing I did, is made sure everybody reviewed on Google, because that's where people go to try and see if it's a reputable spa. I always ask my client when they come in, so how'd you hear about us when they're new? How'd you hear about us? And almost everyone says, well, I saw you on Google. So you looked at our reviews. Yes, your reviews, and they were amazing. And do we have 100% 5 stars? No, we don't. We do have some of those clients that were not happy with us. However, the majority of our reviews are great, and that's what keeps new people coming in the door, which I believe is really important. So start slow, start small, and use your resources that are free.
Yes.
Yeah. So anything else you want to talk about? You don't know? So where do you see yourself in the next 5 years?
With you still.
We'll have our canes, and we'll be injecting with our spectacles.
See a wrinkle?
Right? So, well, thank you so much for being on the show.
Thank you for having me.
Yes, and I'm going to have you again. Hopefully, we'll do this like every month.
I feel honored.
Okay. Cheers, yo.
Yes.
To Medical Spa Aesthetic.
Cheers, guys.
Thank you for joining us on the Glow Up and Get Real podcast. Here's to fearless beauty and real talk. Until next time.